It was an incredible eye-opener for us, the amount of viruses that in the air that we found from intestinal diseases, and that's no new information. We know that in the human side, noroviruses, some viruses, Ebola virus, it is also present from gastrointestinal, evacuation, like on toilets, or so they can found it in the air. And in our case, we were able to find large quantities of virus, and with experiments that we did with PED and also with PED in the field, we were able to find large quantities of PED virus in the air, even without clinical signs.
Hello, welcome to Meet the Expert, the podcast series on swine health management in practice, brought to you by Boehringer Ingelheim. My name is Peter Best. With me for this episode of Meet the Expert is international swine veterinary consultant Dr. Carmen Alonso from Spain. Dr. Alonso, thank you for being our guest.
Thank you, Peter. Thanks for the invitation.
Today we're going to be talking about a particular area of your expertise, which is the potential for swine viruses and other pathogens to be distributed or transmitted through the air between pig farms and between different sections of the same farm. Dr. Alonso, you studied this subject. Do you think you're the expert here? How do you rate the importance of airborne transmission in terms of how pig pathogens are spread?
Well, Peter, airborne route is not the main mode of disease transmission. Let's say that in this case, for the swine industry, and I base my answer due to the quantity of viruses that gets emitted, right, when aerosolized, compared to the amount of virus that it gets transmitted when we have a direct contact animal to animal. So it's not the main mode of transmission. However, it is a very important one, depending on the specific diseases or on a specific epidemiological scenarios. So.
Okay, and how good is our knowledge these days? Do we have the knowledge we need to give the advice to farms?
Veterinarians are well trained on explaining producers on how disease is transmitted. However, sometimes we have a challenge when we try to demonstrate that, and with that, it comes into a play. Do we have the right equipment? Are we doing the testing of the air in the right conditions? And I'm telling you that because that was the focus of my PhD, and I really suffer, and I learned. It was an incredible course of learning. So
this was University of Minnesota, wasn't it? Your PhD,
correct?
On veterinary population medicine, and you did this study then on airborne transmission of swine viruses for that work, didn't you? So could you tell me something about how did you study airborne transmission? What were the things you felt still needed to be found?
So from my PhD working with Dr. Monse Morel, we demonstrated how viruses from farms were emitted, from farms that were experiencing outbreaks. So we demonstrated how those viruses were getting aerosolized, and we were able to find them in there. And with that, we work on finding the right equipment, also working on the right conditions, etc. So and we not only work with respiratory viruses. That's something sometimes we needed to explain, that we work with intestinal viruses that were more systemic, such as PRRS virus, and also we explain how viruses get aerosolized, because so we didn't really work on transmission. We work on finding viruses in the air and expecting that the movement of those viruses, the arrival of those viruses to neighboring farms, that was kind of like the second step from my PhD, because we work on mathematical models utilizing particle size, different variables that we record during the studies.
Now, you mentioned equipment that you were going to test out, and you mentioned particle size. Is that the equipment for measuring the particle sizes that you had to investigate first?
Yes, first of all, we needed to be sure that that we have the right equipment, and that when we were finding a negative, for example, or a positive one, we needed to be sure what kind of particles we were capturing, where other particles we were missing, to understand what's present in the air.
There are standard sampling pieces of equipment available, but some of them are not catching the smaller sizes. Would that be true, or when you did
Correct.
your study anyway? Yeah.
Correct. So we first of all we work on standardize what kind of particles those air samplers were capturing, as well as understanding what airflow capabilities within a specific room, due to volume, right? Because you're just sampling, you have turnovers of the air, sometimes very high. You're just capturing a little bit of air. You need to understand what's the meaning of your results
Yeah,
when you
sure.
get an air
Yeah.
sample.
Okay. Now, how do you do this? So, if I went into a farm and you said to me, Peter, go and sample some particles, I would presumably go to a ledge and try to find a layer of dust or whatever it was. But I'm sure that's not the most scientific way to do it. What are you talking about when you say collecting and capturing samples of particles?
So, sorry, but what you were you saying was not wrong. Like, because what we find as an environmental sampling is particles that have been aerosolized and they've been settled. So you were not wrong. But when I say that we were collecting our sample and capturing samples from the air, what we do is we capture whatever is in the air, and we retain it with different mechanisms. Sometimes it could be washed within a fluid, and what we do is sampling that liquid for PCR. Sometimes we filter the air, and then we capture whatever particles are in the air on different type of filters. Sometimes we impinge, right? We get whatever particles we found in the air, and then we kind of like inject those on a type of device that will allow us to capture whatever is in the air. So there are different types of air sampling, and we just need to understand them and see what the meaning of the results, or the meaning of what we are sampling.
Do you mean though sampling at a point of time, so you get a distribution of particle sizes and whatever, or are you sampling over a period of time? So
So
you have a representation of a day or whatever it is.
it's depending on the device. Some we normally sample for a period of time, and we consider the amount of air that we've been testing, and with that, and also the concentration of that virus in the air, and with that result, we can refer to the concentration of airborne particles per cubic meter of air. Sometimes we can go longer periods of time depending on the device. Sometimes we go shorter periods of time, but at the end we refer to volume of air.
I'm with you. And you talked about small and large particles. Could you give me some size range of the sort of sizes that you were encountering in your study? How
So,
small, how big?
so we work with particles that are representative for creating an infection within the respiratory with the respiratory tract, and those are lower than 10 microns. And this is always controversial, because what's a droplet, what's a truly airborne particle, and we sometimes in the scientific research literature, we talk about the 0.5 micron cut off. So anything lower than 0.5, it could be considered truly airborne. Sometimes consider name as well as droplet nuclei. So very small particles that can remain airborne for longer periods of time, but anything larger than 0.5, sometimes referred to the 10 microns, is what we consider droplet. And those droplets are larger particles made from a lot of virus. So they are more infectious. They have higher potential to transmit the disease or to infect other animals, and they also they are an environmental contaminant because they settle close to where they're getting emitted. So from the animal that is infectious.
I am with now. To state the obvious, as a non-scientist, as I'm certainly no scientist, your interest in particles was as vehicles or vectors of viruses in your study. That would be right, wouldn't it? The distribution or transmission of viruses. I mean, these viruses don't fly by themselves. They have to find something to carry them. And this is what these particles are doing. And these particles are being created within let's say, a barn or in a room of a house, and then being expelled out of that room in some way so that it can carry the viruses to another section of that population or even another population. Would that be right? That's why you're interested in these. Would that be therefore much more important for respiratory viruses and for enteric viruses? I've always thought of airborne transmission as being, something for the respiratory viruses.
Correct, and it was an incredible eye opener for us, the amount of viruses that in the air that we found from intestinal diseases, and that's no new information. We know that in the human side, noroviruses, some viruses, Ebola virus, it is also present from gastrointestinal, evacuation, like on toilets, or so they can found it in the air. And in our case, we were able to find large quantities of virus, and with experiments that we did with PED and also with PED in the field, we were able to find large quantities of PED virus in the air, even without clinical signs.
Good.
So
That was not expected then. I mean, this is porcine epidemic diarrhea,
correct. Sorry,
PED.
yes.
No, that's fine. And you were finding it almost everywhere, even where there was no evidence of pigs being sick.
Well, we knew that animals were positive; they were coming from a positive source, but they were not. There were no clinical signs at those nurseries, and we found PD virus in the air in large quantities as well.
Would that be a function of the physical characteristics of the PED virus would make it so ubiquitous in this way? I mean, why would it be so widely distributed like that?
Oh, it doesn't have to be with the virus, because viruses they behave as particles, and particles behave the same way, no matter the nature of the particle. But we know that PED gets excreted in large quantities when animals are positive, and they contaminate the environment. We found them in large quantities everywhere. Let's say.
Do they like big particles or small particles, or they don't care? Any particle could have a PED virus on it.
In the case of PEDV, we found them in large quantities in all particle sizes, and that was the key for our studies, is that understanding that we know that now PD virus is able to transmit not only on droplets by contaminating the environment and moving tools from within the farm, or just stepping in and out the facility, but also is able to get transmitted longer distance, because we can find it in a very small particles. So those are the ones that get exhausted from the farm and get transmitted long distances.
One assumes from the ventilation system of the farm normally would exhaust the air out with these small particles, and then they go presumably windborne quite some distance.
Correct.
Now, okay, that's PED. How were the other viruses, the respiratory? And by the way, which viruses did you say the respiratory ones you studied were? PRRS was one?
Consider PRRS as a more systemic virus with a component of respiratory virus, but also influenza virus.
IAV, yes. Yeah. So, and was their behavior in terms of the particle size, any different to that of PED?
So yeah, there was a big difference. We didn't find that amount of virus in the air. So for PD, we found large quantities. That wasn't the case for influenza and PRRS. That was the biggest difference, right? But also the type of particles that these other viruses got associated. So we found that we found higher quantities of virus detected in larger particles, and with larger particles, we said more than 3.3 microns. So not very large, but larger than 0.3, that were the smallest. But in the case of PRRS virus, we found more PRRS, the more quantity of PRRS associated to the larger particles. Those were particles greater than 9 microns.
I see. So, by definition, fewer PRRS virus on smaller particles that went further distances.
Correct. So it's a combination, like smaller particles are made of a small quantity of viruses, but those are the ones that are able to be transported longer distance. On the other side, larger particles are made of larger quantities of viruses that get settled closer, right? At the same time, they are more infectious.
Yeah. For your comparison, how did you manage to take away the variabilities? For example, the stage of infection of the animals during an outbreak, or the amount of animals in the airspace, and so on. Could you equalize these sort of things so that you were comparing like with like?
You mean PRRS with influenza, for example?
Yes, that's right. Yes.
Right. So with influenza, we found that the amount of virus in the air was within the 5 days of the infection, and we understand that how influenza behaves. It also we're seeing that now, analyzing the cough, right, of those animals, and we are able to find influenza within the first 7 days. On the other hand, with PRRS, we found it up to longer periods of time. So we were able to find PRRS. I believe it was more than 18 days. So lower quantities of PRRS, and that makes sense because of the way the virus behaves in the animal. Is a systemic virus. It gets distributed differently. It's not a truly respiratory, where the animal gets the right to excrete the virus from the upper respiratory tract. So
Yes. Yes. It's not so much a coughing effect as such.
correct, yes.
Yes. Yes. I'm with.
Specifically for, in this case, was these numbers and those values are for research that we do on challenges under control conditions. We perform the same in the field, and it was more challenge to find the person there in the field, just because the quantity of virus that get excreted is lower than compared to, in this case, influenza or, of course, PD.
So we're talking about, Dr. Alonso, you're talking about your measurements, and when you went to see how far the distances these particles were traveling, how far did you start your investigation? How far from the outbreak herd did you start looking?
That's a good question. That will be depending on the virus, because we know the quantity of virus that gets excreted from an outbreak. And a specific example we had on two different viruses that was our experiments, our research on highly pathogenic avian influenza. Highly pathogenic avian influenza, correct, on poultry. We were able to find just genetic material 1 kilometer away from the farm, and we matched that with the outbreak. It was incredible, the amount of virus of highly pathogenic avian influenza that was being excreted, right? So we found it at 1 kilometer. A very similar situation was with PED. We found PED several miles away from the facility, but in this case was not infectious. Again, it was just genetic material. Well, we and those are the two main characteristics. So depending on the type of virus, we know how far we can go. We also consider time of the day, because UV light will affect survivability of the virus, as well as wind direction. So those are
Yeah.
one of the different aspects we
These
take into
particles they've
account.
travelled on, would the particles themselves have had any impact on the viability of the virus at a distance?
Yeah, of course, like the farthest smaller particles are the ones that are able to travel longer distances, but at the same time, if the humidity is not the right one, or is affected by the UV light, they get inactivated. So that's why it is pretty difficult to really find a particle in the air sample at longer distance that is infectious.
Yeah, but certainly in your work, you have to choose your time of day, so UV light, as you say, and you presumably started your investigation at the furthest point from the farmer and worked backwards with your investigation to take samples of that point. So you were measuring very small particles at that stage, weren't you? Far from the farm.
Correct. We start in the most difficult scenario on the right moment of the day. We start very, very early on the sunrise when we know that humidity is right, temperature is low, wind spin is on the way that we are taking samples. We create a barrier of our samplers to try to capture as much particles getting emitted from the farm. There are many components of those research projects that they make them so that they make them great.
Yes. Now, the impression I'm getting, Dr. Alonso, is that, the smaller particles, they go further. They've got what shall we say, a smaller viral load than the large particles, but these could still be infectious at a certain point. But presumably, the larger particles, they present in many ways a greater transmission risk, but they don't go so far. Would that be would that
Correct.
be correct?
Yeah,
Or
and that's because particles are surrounded by material and also by other viruses that protect their infectivity. So not only quantity, but also the conditions of those larger particles is better to preserve their infectious capability.
but those large particles don't go very far.
Correct. Those are the ones that settle closer to what they get emitted.
Well, they just exit the building and then settle on a surface of some sort.
Or just settle around the animal if the airflow is not as high to pull them out of the facility. But depending on the situation of time of the day, we know that fans they run as much as they can to remove air and to create better air quality within the room. So those are the moments that they're really pulling a lot of particles out of the facility.
Yeah, but the larger ones, how far do they go? They just go a short distance from the exhaust of the fan, or
Mm-hmm.
so that they might reach a feed bin or something. But or can they go further than that? I mean, are there ways they go further?
They settle close to where we believe 1 meter, 2 meter, but it will be depending on the wind that is blowing at that time or
And the direction of the exhaust
direction.
fan.
Yeah. Or
Yeah,
also
yeah,
they can
yeah.
go very far. If you have a truck, just park right there and you move the truck as far as you go. You know that those large particles can go very far if
Oh,
depending
the truck takes the large particles
away
and
and far away
distributes them.
from. Yeah,
Yeah.
yeah, yeah. We we
So,
we have experiences on that on distribution of fomites far away from where they get. Well, there was an outbreak, and may who knows if it was just air
well, feed
droplets.
feed trucks but you started making me think about cars because we our cars are whether we're visitors or farm workers or whatever. I mean, could they be the unintentional means of transmission because they are parked in the wrong place near the exhaust fan or whatever it is, and then carry the virus on the particle a longer distance. Can cars do that?
Yes, and we have and we have experiences of sampling surfaces of cars and handles of the car, and we know that veterinarians and anybody that visits farms, it is a common practice to shower out, right? So we do all the effort of keeping everything that is from the farm in the farm and putting our own clothes and getting our booties and get cleaning our car. But depending on where we park the car, or on a barn that is experiencing a serious outbreak, and fans are blowing against your vehicle, and we know that you can just be carrying particles to different places without knowing, and without doing it intentionally.
So it's just simply opening your car door could undo
Correct.
all the work of showering out and everything.
You can just bring the virus in and handle and put it in your hand. So
Yes, yeah. Now, what can we do, please, from your study? What does it tell us about the means of, if we can't prevent transmission, reducing it, airborne transmission? What, from your studies and your expertise, is possible to do? Are there things we can do in terms of filtration of air or other things of that nature? What would you say are steps that we might consider to mitigate airborne transmission of a swine virus?
So anything that will remove particles from the air will help, right, to decrease airborne transmission. But something that we do, and it's been demonstrated, is just by vaccination. We know that vaccinating animals decrease clinical signs, symptoms. Many times, in the case of PRRS virus, right, we don't prevent sometimes the animals to get infectious, but if it's not the same strain, but we diminish and decrease the amount of viruses in the air and day of positive virus in the air, and that's well demonstrated. So that will be a good mechanisms to prevent airborne transmission as well.
So vaccination would be one thing. I mentioned filtration of air. Do you I believe you've taken a look at filtration systems, haven't you? Do you believe they're economic? Do you believe they're viable?
Air filtration, it's a possibility, and it's a great technology that has been implemented in many parts of the world successfully. It decreases the amount of outbreaks significantly. Um, so on the right condition, under the right situation, after accounting for everything that you need to be taking care of in the farm prior to install filters. It's a great technology. The value of the animals inside, they needed to be protected, and also if you are in a location high density, when you know that airborne transmission is a high risk, the technology is there, and is cost effective in the specific situations.
But it is very much something for a high value farm as a of the ultimate action. There are other actions in between that we could be taking in terms of making sure that we are not, let's
Bringing the
say,
virus in.
distribution.
Yeah, yeah.
Yes, yeah, keeping it in and so on. Yeah. So I'm going to say, Dr. Alonso, many thanks indeed for your help with this subject of airborne transmission. I've learned a lot from that. So I'm going to say also to our to our listeners and those joining us today, thank you for joining us. Now, we are just running out of time, so one or two small points I would ask just to complete this. We talked about mitigation on farm. I've been reading about ionization systems. This was something that's been tried in the past. Does it still have a place in terms of reducing this? And also, I'm going to ask you, how much is airborne transmission related to air quality within the swine building?
So to your first question,
Yeah,
Peter,
ionization. Yeah, yeah.
ionization. Yes, we try them, we test them at the University of Minnesota during my PhD, and they are very efficient at removing dust from the air, like just particles. So the improvement that they've done on reducing the airborne transmission is by clearing the air. On the other side, there are many other actions that we can take to remove particles from the air. That's we need to pay attention to the feed, the way we present feed to the animals, like mash instead of pellets, or so that will also help. Also, have the barns clean of dust. Clean them. Frequently. So there are other strategies that we said that they're efficient and more affordable. Let's say that way. And
Right.
to your second question,
Yes.
that I can't remember
Air
right now.
quality. I said, we've been talking airborne transmission. How much is
Okay.
it the same story as air quality in the barn? Particles are all about air quality, aren't they?
Correct. Yes. So it's by putting the attention that it requires to having a well ventilated farm and good air quality. What you're doing is removing the particles from the air that are the ones that viruses get attached to get transmitted. So that's a very clear point when you were having an outbreak of respiratory virus, and we try to preserve them warm, and we close the windows, and we close the blinds, so we prevent fresh air to move that air. So I try to explain that concept to producers. So it's the other way around. We try to ventilate better than never, and that's just by removing particles from the airspace where the animals are.
At the start of our conversation, you talked about developing better sampling equipment, and I would like to know, do you recommend routine sampling of the particles in the airspace of a swine barn, as part of your veterinary monitoring of a site? Do you think that routine sampling of the air is a useful thing to be doing?
I think we have other methods to monitor animals that are more that will give us more information that air sampling. Just understanding how viruses get excreted on an infectious animal. We know that influenza. We know about birds. So just by knowing that animals are positive or experiencing an outbreak, and we have good methods on oral fluids, or we now have a coughing index, so that we can matches with a specific pattern of coughs with a specific disease. So just knowing that the animals are positive on a specific disease, we know that particles will be in the air. So knowing the challenges of air sampling and how tricky it can get, right? I don't believe it's the method to routinely monitor our animals.
Oh. Dr. Alonso, I'm afraid we must finish there. I do wish we could continue, but I think we must stop. So thank you very much indeed. We've been talking to Dr. Carmen Alonso in Spain. Dr. Alonso is an independent veterinary consultant. Also, we've heard now principal of Up North Analytics, a new company which is looking at the integration of production data and health data, and cough monitoring and other ways of monitoring the herd health situation. Dr. Alonso, many thanks for your help today. To our listeners, thank you for joining us. Other podcasts in the series will be coming along, but for the moment, stay tuned. Goodbye.